everyone. Welcome to Compliance Deconstructed, brought to you by the lovely Elvan Baker, Lorie Davis, and Jessica Zeff. And we've got an absolutely brilliant episode for you today, something that's not often talked about. We're going to talk about Medicaid in particular and a type of audit. Lorie's going to go into more detail, and Elvan and I are going to be cheering on the sidelines and inputting and butting in. But they're Medicaid audits called ECRO and ISCA. And many folks listening to this podcast, I would bet, don't know very much about these two audit processes. Medicaid is a very specialist field. If you're interested in getting into that space, there's a lot to know. And these are two very important topics that we think our listeners probably would like to know more about. So, Lorie, do you want to kick us off and just tell us a bit more about what ECRO and ISCA are, starting with, what do those acronyms actually stand for?
Yeah, so thanks, Jessica, and good morning, Elvan. So this for me, this is the Super Bowl of Medicaid audits when I think about it. In Medicare, you have your program audit and there's other big audits, but for Medicaid, this is really the big deal. There are two things that go into it, but first, let's take a step back. What is it? Why do we have it? How is it managed? What happens in your state? I'm so glad you asked. So first, ECRO stands for External Quality Review. EQR is what some organizations have called it. EQR, ECRO. Now, there is an O that gets added to the end of that external quality review for the organization that conducts this audit. So there is an external quality review organization that is the technical ECRO running your EQR or your audit. There are 10 protocols under the ECRO umbrella that are administered by CMS. There is a lovely 400-page document that if anybody's interested, I'm happy to share that link. It's a good bedtime read. Okay, maybe not, but for Lorie Davis, it is. Uh, and it really gives you the breakdown and the flexibilities. The next question is, how is it managed? It is managed differently everywhere that you have Medicaid because no two states may do it identical or they may do it the same. And a lot of this is also dictated by that EQRO, that ECRO that gets selected to run the program. So some states have elected to do it all in 1 year, year over year, as required by CMS. Some have taken it to a month by month breakdown, and there's activities happening throughout the year. And then there are some states where they are reviewing it annually, but only a portion of all of the protocols get reviewed every year. So there is a lot of different ways it can be done. Jessica, I see your hand up. I'm assuming you have a question already.
I do.
I love questions.
Okay, so actually, you know what? This is terrible, but I didn't know about that O. I thought it was a
Yeah.
pronunciation issue because
Mm-mm.
ECR is actually quite hard to pronounce. So that was interesting. That already I've learned something.
Mhm.
The other point I was going to make is that these audits, they're specific Medicaid audits, and they're very different for a number of reasons. So just for folks, everything I know about ISCA and ECRO has mostly come from Lorie. She's been a really great teacher and she knows the stuff inside out. She lives and she breathes it. So hang on to every word because you've got a resource here you're not
Wow.
going to get otherwise.
Thank
But
you. Okay,
check my
go ahead.
understanding, but I'm
Yep.
checking my understanding, right? So these audits look different in every state because Medicaid is different in every state,
Yes.
right? And
Yes.
so
Yes.
states will hire, at least some states hire outside organizations. They kind of what is it? They contract out
Mhm. Yep.
this audit. And that's
Yes.
the ECRO organizations. And they'll hire different, each state will hire different organizations to do these audits. And they're almost like is an organization ready for a Medicaid to get into Medicaid, or are they compliant with
Yes.
Medicaid requirements? So that's what
Yes.
these organizations do. They assess on
Mhm.
behalf of the state, hey, is this particular health plan, am I right? It's usually a health
Yes.
plan. Are
Yes.
they ready to administer Medicaid on behalf of the state? And they're all very different. There are different organizations who do these audits depending on the
Mhm.
state, and they'll use a different methodology. So you
Yes.
really have to understand your state.
Mhm.
So I would say the methodology is determined by the ECRO protocols. So there isn't too much variance in, at the end of the day, the protocols. The one thing that I also want to make very transparent is within those 10 protocols that we talked about, there are some that are required, meaning they must be
Mhm.
evaluated every year. There are some protocols that are considered optional. And that's where, when you start to see that rotating 3-year basis, you start to see that. There is a heavy emphasis on quality. So, for my friends that may work in quality improvement or support the clinical teams, that's where your HEDIS measures comes in,
Mm.
your improvement projects, or what we call PIPs, that's where they come in. It's really designed to make sure that a health plan, regardless of type, whether it's a managed care, a prepaid plan, somewhere in between, that they are being faithful and true to the contract that they signed with the state, that they are working in the best interest of members, and they're working to be timely and accurate and keeping information safe and secure. So, one of the components that comes with ECRO on top of those 10 protocols is something called an ISCA, or an internal systems capability assessment. And that is meant to supplement those 10 protocols, but it's also really designed to heavily lean into your data systems and IT systems, again, to make sure that information is kept secure, that it's transmitted safely, and members' information is kept safe and secure. And I think I've repeated myself, but really that's what ISCA is meant to do. And some states do them all at once, so a couple days on ECRO and a couple days on ISCA. Some will do ECRO at one time and come back for ISCA, or vice versa. They'll do ISCA first and then ECRO. And again, in the states where they've got the performance measure validation protocol in place, they will issue the ISCA with that and work in tandem. So there's a lot of flexibilities between the states to do that. Elvan,
So
Jessica, am I making sense?
you
Mhm.
are making
Mhm.
sense. I just
Mhm.
wanted to unpick what you said a
Mm,
little bit.
yep.
Because there's a lot more going on there. Like you simplify it, you make it easy to understand and to get your head around. But the truth is, so there are a lot of things going on and they're kind of layered. So you mentioned the contract with the state. So if you're
Mhm.
going to get into the Medicaid or managed care space, you're about to sign a contract with the state, but in order to get to that point, you've got to meet certain standards,
Quite.
and you're going to
Yes.
be assessed, and there's a contract. Usually, I think, correct me if I'm wrong, Lorie, you're my expert on this, but the states publish like a template or a draft contract so that you know, as an organization, what you need, what your infrastructure needs to look like, what you need to deliver, what those compliance requirements are before you ever sign the contract with the state, because you're going to be
Yeah.
assessed against those requirements.
So
And then
you'll be
on
doing what they call a readiness review before you go live. Yes.
So
Yep.
you have a readiness review, but a lot of that, I mean, brings together the requirements from the ECRO and the ISCA. So you've got layers. It's
Mhm,
not just enough to get that template. You've got to have some insight as to what the ECRO will look like, what the ECRO will assess, what the ISCA looks like, because
mhm.
you've got to use those to develop your infrastructure in the first place. So there
Yes.
are a number of layers. You've got the contract to look for,
Mhm.
you've got ECRO, you've got ISCA, and all of
Yes.
those build on each other, right? And then
Yes.
on top of that, some states will choose to do a big ECRO or ISCA audit all at once and everyone's involved and it's a really big thing, or other states will kind of parse out that
Yes.
audit over a period of time and they'll have different methodologies, but they'll still be working to the same protocols and making sure
Correct.
that the organization is compliant.
Correct.
And Elvan, sorry, I'm going on like a steam train. What were you going to say?
No, I was just going to add to exactly what you said, is that so there's no blindsiding here. And I think there is sometimes general perception that the government blindsides us, the systems blindside us, and it really is not.
No.
Um, when they give you those templates ahead of contract signature, you know what you're getting into, therefore you know what you'll be held against.
Yeah,
Um,
I
yeah.
one thing I do wanna say, Elvon, though, because I think you bring up a really good point about that perception around blindsiding. Everything that goes into an ECRO and an ISCA is really based on your data.
Mhm,
And if you know your data,
mhm,
you should know, and I call them warts, right? But you should really know what your warts are in your data. If you have something that you've dropped the ball on as an organization without calling, things happen.
mhm,
We're people. Like, this is not meant to say, oh, bad person, bad, bad, bad. But
mhm.
you know your wart, you can already be working on a remediation plan before that audit so that when they come in and they ask and they point to that thing, you can be like, "Yep, we know this is what we're already doing," because
But
it's
we,
better
yep,
that you're working on it before they tell you how to fix it.
we talked about this in the past, time and time again, on different subjects, is that
Yeah.
nobody is asking perfection
No.
from any segment of compliance. The
Yes.
general tendency is to look for continuous improvement
Mhm.
and standards to ensure that there is an aim, not the end
Mhm.
result, but an aim at
Mhm.
improving the process. So, yep,
Yes.
agreed.
Yes.
Mhm,
So I have
I just
so
I wanna make sure though that when you say
mhm,
blindsiding, I understand why people have
mhm,
that
mhm.
perception, but it's really because maybe they haven't dove into their data deep enough or their case
Mhm.
files or whatever.
It's like
Sorry,
the,
Jessica.
like you get a,
that's
I
okay.
apologize, a healthcare facility, and they're like, oh my, the surveyors are here. Time out, time out, time out. If every department did what they were supposed to do, they can just come and leave, and they will come and leave. This is something interesting. It's like nobody wants to be there. Like they want to come and put the check marks and leave. There is no us versus against them. Again, the same
Yeah.
perception. Go ahead,
Yeah.
Jessica. I'm sorry.
There are so many things though that from experience, ladies, and you know this. I know certainly when I'm working
Mhm,
with my clients, and I know the both of you have been here. You get so many people or
mhm,
organizations who are afraid to ask. Like, let's be honest, right? When you read the model contract or when you read the ISCA or the ECRO protocol, it's not necessarily written in plain English, right? You do have to have
mhm,
some experience in the field, but maybe you have questions. How many organizations, and I know you have, you've worked with, and they don't want to go back to the state and talk to the state? So I just wanted to ask you, Lorie, how important is it to work in partnership with the state that you're in?
Oh, it's
It's
huge. It's huge because there have been times where I have sat at that table and the state will advocate on your behalf. No, no, no. I know they're doing this. We've talked about this versus, if you haven't had the conversation, how can the state advocate on your behalf? And I think In some states, that's hard to do because you don't have a dedicated person at the state. You don't have a regulator one-on-one that you're dealing with day in, day out that can advocate. So I don't think in every state that can happen. In some states, you are meeting with someone at the state on a recurring basis. They can advocate on your behalf, but it doesn't happen in every state. So that can be difficult.
And the other thing I found is that, when an organization wants to develop a new part of their
Mm-hmm.
infrastructure, and actually it requires input from the state, ultimately it's going to require approval from the state. Let's say they're developing new software and it actually, requires it they need to liaise with the state and get the state's input and even approval. But they're reluctant. They think they know what the requirements are, they think they know what they're going to do, but they never consider, actually, wait a minute, I better run this by the state, because if they don't approve this, I've now sunk millions of dollars
Mm-hmm.
into a system that I cannot use, and
Yes.
that's drained our company of our resources, and not just money, but the time and the effort that could have been spent elsewhere. And I've seen that time and again, where organizations, not only do they not think about it, when you raise the point and say, slow down, wait a minute, let's go back to the state, introduce them to this, get their input, engage them in the development of this product, so that later on, when you need them to approve it, they're like, yep, we know all about this. They're often reluctant. They're scared. They don't know what that means. Have you guys seen that in your work?
Yes. So there are some organizations that have taken that it's better to ask for forgiveness than permission
Mm-hmm.
stance. And that has obviously had varying outcomes. But I do think this is why knowing the agreement that you've signed with the state is so essential. Your business owners need to know it. You're, the quarterback of the audit, but they are the running backs, they are the tight ends, they are the people that are truly showcasing their skills. The auditor does not want to hear from compliance during an ECRO and an ISCA unless it's the compliance section,
Right.
which is a very small section typically. But really, they want to hear if they're talking about claims, encounters, enrollment, appeals, grievances, service center, member services, provider network, provider contracting, provider relations, clinical management, utilization management,
That's right.
medical directors. They don't want to hear from me about any of those topics. They don't want to hear from Jessica. They don't want to hear about Elvan. It's not that they don't love us. We
Mm-hmm.
talk to them on a recurring basis, probably
Mm-hmm.
about other topics, but during ECRO and ISCA, this is where your business owners shine. And it's essential that they know the contract frontwards, backwards, upwards, downwards, and all the Wonkaverse ways, because the auditors are going to be like, okay, well, in section blah, 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 this is what it says. And they're looking for your policies to quote the contract. They're looking for the business owners to talk about the contract. So when I think about my friends in quality, NCQA. NCQA certifications or accreditations are huge, and more states are starting to require them, and not just the main NCQA. There's subspecialties that can be accredited, and they're looking for plans to do that. And so you need to know what your contract says about NCQA, because along with things like HEDIS measures and PIPs and quality performance measures, all of that plays into what they're looking for. And there's this perception that NCQA dictates what states do. No, it's what CMS dictates, and then NCQA gets on board with it. And NCQA has done wonderful things
Mm-hmm.
as it relates to HEDIS measures. And
These
so
are all
I'm a
different
big
kinds
fan.
of standards and
Mhm.
metrics for
Yes.
those folks who aren't necessarily involved in managed care or aren't involved in healthcare compliance, but you're listening it anyway because you love us and you're curious. These are
Yes.
all different kinds of metrics and standards
Mhm. Yeah.
that organizations in the healthcare space need to be demonstrating.
Mhm.
But
Mhm.
just, it's obviously a very complex space, and these ISCAs and these ECROs are undoubtedly intense. They are designed
Yes.
that way. So I'll start with Elvan. How do you and you need to prep your staff, right?
Mhm.
Any suggestions or recommendations about how you can get your staff ready for these audits?
I made a post the other day, and I've been thinking about this quite frequently recently, is that I believe every team member needs to understand the little pieces of the puzzle and who they are as a piece of the puzzle. Some people will hold 5 pieces, some people will 15, some people will just be 2. But they need to understand the big picture, how the piece of the puzzle fits together, and where they fit again as a piece of that puzzle. Same thing for any kind of audit. So to me, they need to understand that how their daily, monthly, yearly actions affect how this audit is going to perform at the end. It's important to explain to individuals that there are work tasks that are created, and it's okay. This is a part of the professional growth too, in my opinion, and a growth of an organization, is that there are certain work tasks that you do in preparation of audits within a compliance space. There are certain tasks that you do in prevention of fraud, that, like, not everything is, we can't be everything to everyone at all times. Not every task is going to be designed to serve a patient. When this audits do serve a patient, it's in an unrelated, in an indirect way, I
In
apologize.
an
But
indirect way, yeah.
yes,
No, no,
so
no.
I do want people to understand that there are certain tasks that they will be doing that is specifically designed for this audit to perform, or for them to perform well on the audits. And it's okay. And it's okay to say that, hey, we already do this check mark in 2 other platforms. Why do I have to also hold count on this Excel sheet? We just use that one specifically for the audit. It's okay. It makes things clear for the auditors. It makes things clear for the regulators to pull the information.
So there's that infrastructure, structural
Mhm,
support, and there's
Mhm.
also training, is what I hear you
mhm,
saying.
mhm, mhm,
Oh,
And I
yes.
know that I like to do specific audit prep, whether it's an
mhm.
ECRO or an
Oh, yeah.
ISCA or anything that
Yeah.
comes in, because
Yeah.
I've been in so many situations, and Lorie and I have talked about this as well, where we've seen people freeze. I mean, even
Mm.
senior leadership freeze. They're being asked to comment. I've seen people walk out. I've seen people burst into tears because they just got overwhelmed. I've seen people like stumble around what they're saying, or other people contradict themselves. So
Yes.
what I realized, and I think we've all been doing this long enough, people get stressed. They hear compliance or regulatory or auditors, or they hear the word test or
Mhm.
assessment, and just automatically get so stressed. So, how do you kind of get people to not be so anxious so that they can represent what they do accurately and calmly? And I mean be truthful. I don't mean make stuff up, but I mean
No.
not get to the point where they feel like they can't open up their mouths. So
Yeah.
I try to do a lot of training and even
Mhm.
like mock interviews, and just kind of show people, actually, here's the kinds of questions you might get. Now let's
Mhm.
work through some reasonable responses. Tell me what you do. And and just get them to practice a little bit so they're not so stressed. I don't know, I've just seen people react so badly, and it's just
Yeah.
anxiety. It's not because
Yeah.
they don't know their work, and so that concerns me. And do you have
I
any techniques, Lorie?
Yeah, I'm really big like you are on those interviews where I like to play either the mean auditor or the really kind auditor, whatever, I flex styles, but sometimes you need that. Be like, "Hey, well you said in the RFI XYZ, why does your policy say ABC?" And like point out something where something changed. Why is it different? Not saying that it's wrong. It may not be wrong at the time of the audit because it's always a look back. Things may have done X and then something happened and then you went to Y. Let's talk about it. What happened? Give them a chance to showcase their knowledge. The one thing that I like to do is reinforce to them, nobody's going to know this better than you.
Mhm.
Nobody does this job. The auditors don't do your job. Now, to the auditor's credit, many organizations will hire seasoned professionals to be the
Mhm,
auditors. So
mhm,
someone who's been doing enrollment or claims or worked in a service center, worked in provider, worked in encounters, whatever that is. So they are bringing in their subject matter experts. But again, that subject matter expert, unless they were doing your job, don't know the job as well as you do.
mm-mm,
Reinforce that your people are experts. Make sure that they know what they need to do. Read what you submitted. Read what attachments you provided. If a colleague from another area also provided a response to this question, because it's really important to remember that when they issue these requests for information, these questionnaires for ECRO and ISCA, they don't assume that Elvan works in enrollment and she's
mm,
going to be able to answer. They ask a question. And so Elvan, who works in enrollment, may have to work with Jessica, who works in appeals and grievances, to combine the response to a question. So I always like to take a look at the questionnaire, make sure that I do a draft assignment of ownership, and then let the business owners come back to me and say, hey, Lorie, I think I need enrollment to help me answer this question, or hey, I need encounters here, or whoever they need, and then foster that. And then when you're doing the prep section, make sure you have everybody in the room who's going to be there on audit day for that section of the agenda to talk through things so that you can feed off of one another. So that if Elvan says, oh, our 834s come in the back door from a truck that backs up to the door, and Jessica's like, well, that's not what our policy says. Our policy says they come in the front door and talk to the security guard, that you have a chance to talk through that difference of perception and have your story straight for the auditor. It's not saying Jessica's wrong, Elvan's wrong. This is a matter of Jessica only sees them on Monday, Wednesday, Friday. Elvan sees them on Tuesday, Thursday, Saturday, Sunday. Both stories are true, but framing matters.
mhm.
So I think that is one of my big things to prep, is make sure you have everybody you need available, and encourage them to do their own prep sessions where you're not there. Let them talk amongst themselves to build up one another, to partner together. That breaks down the silos in an organization too.
I love it. Like, but there's so much. I think what Elvan was saying about,
Mhm.
making sure folks understand the bigger picture and where they fit in and how they
Mhm,
contribute is
Yes.
essential. They
Yes.
also, staff also have to understand and teams have to understand it's not a test of them. No
No.
one's, it's not a test. And they feel that though, right? It feels
mhm,
very
Mhm.
personal. And
Mhm.
these are all ways of trying to get folks to understand it's not personal. It's about the organization. You can talk, you can come together, and it's about representing, what we actually do.
Mhm.
Hey, you said RFI, Lorie, and just again, going
Oh,
back
sorry.
to our listeners, no, it's okay. But it reminds, I think, all three of us that this space is pretty complicated. So, an RFI, again, correct me if I'm wrong, is a request for information.
Yes, that's why I
Yes.
called it a questionnaire, request for information, or a questionnaire, or it could be called a survey. I know in some states they call it a survey. I think in the ECRO protocols themselves, it's called a survey. Basically, it's just a really long questionnaire. Typically, your regulator or that third party working on behalf of your regulator will issue it, and any acronyms they use, they will spell it out. So when I said RFI, I meant to follow it up with that's why I said questionnaire.
No, it's
I
okay.
didn't
But
spell out request for information.
what I was going to say is, I mean, it's a survey that kind of, again, when we talk about how complex this space is. So an RFI is really saying, how you're compliant. And stop me at any point, ladies, if I'm getting this wrong. I don't want to tell people the wrong thing, but my understanding is the RFI reflects how you as an organization are meeting the model contract, how you're meeting Medicaid requirements, how you're meeting the ECRO and the ISCA protocols. You're laying out how your organization works. So, of course, your regulators and your ECRO organizations are coming in to say, well, you said this, now show us that you're doing this. And so they're
Mhm.
looking not just to make sure that you're compliant with the contract, with the state, and with the different protocols, but they're looking at what you said you were doing. So there again, we come back to this idea of multiple layers within the organization.
Yes, yes, absolutely. And very often there is a system demonstration component where they will want you to walk through, for example, a claim. If a claim comes in the door, how does that adjudicate? How does it process? If it gets suspended or rejected or denied, whatever verbiage or suspends, whatever happens, they want to understand how does that work? How do you go get more information to make a final determination? What information goes to a member? They really want to
Mhm.
understand if a claim gets denied, what happens to the member? And I know they're starting to look, they also typically ask for a year of claims or a year of encounters because they want to look at the whole process. For care management or utilization management, they also are starting to ask for things like prior authorizations or case files where you're actively working with members. If a prior authorization happens, for example, and the member gets denied or that prior auth gets denied, they want to understand what happened to that member. Did you follow up with the member? Did you work with the provider to get that prior auth resolved so that the member could have the services they need? Same for prescriptions. If a member's medication was denied or they couldn't fill it, did you follow up with them? So there's a very consistent theme, and they want to see how your systems support that effort and the written documentation that goes
Now,
with it.
Lorie, will the ECRO organizations actually talk to members or do a survey of
Oh, that's a
members?
great
Is that a
question.
thing? I genuinely
Yeah.
don't know.
Mhm.
So in
I
my
don't either.
experience, they do not talk to members. But remember that there are typically quality surveys that are sent out to members. And so they may leverage the feedback from those surveys. Or if a service center, for example, they send out surveys, or when you're talking to the service center, and when I say service center, I mean member services and provider services, but in this case, member services, they call in and say, hey, I need a new ID card, or hey, I need a PCP or a specialist, and they ask you to fill out a survey, they may want to look at the survey feedback. So those are things that they do look at, but my experience, I am not aware of them talking directly to members.
I didn't think they did, but I wanted to ask for the sake of our
Mhm.
listeners and because I genuinely didn't know.
Yeah.
I'd like to go back to the ECRO organizations that are doing this assessment. So throughout
Yeah.
my career, I've
Mhm.
been interested in the personalities of organizations. It's arguable. Organizations have cultures, they have
Mhm.
personalities. Well, so
Mhm.
do regulators. They have
Yes.
Mhm.
personalities, they have cultures. And ditto with these different organizations that do the ECRO and the ISCA assessments or audits, if you will. They have
Mm.
different personalities. And sometimes, how does that play out? That plays out in how you maybe interact or how they engage with you at a local level within your organization or how they interact amongst each other.
Yeah.
Can you talk a little bit about that? Because there are some states where there are so many different organizations who are involved in doing these audits, and they don't always connect, and it can be really
Mhm.
frustrating. And some are
Yeah.
very supportive, some are combative. And how do
Mhm.
you deal with that? I
Yeah.
don't want folks, some states I know it's a much more fluid,
Mhm.
streamlined process, but in other states, actually, it's a really frustrating process.
It
What's your
is. Yeah.
experience there and how do you deal with it?
Yeah, that's a great question. And again, because it's Medicaid, it's all different. There are some states where you are dealing with your auditor on such a recurring and frequent basis that you can build somewhat of a relationship with them. Like
Mhm.
you know them. They know you. Hey, I'm submitting that document right now in the portal. Hey, no worries. Hey, we've had a question. Can we talk through it? You can have that really personable relationship. Other times you only see that auditor whenever they're doing the formal ECRO and ISCA. So you may not have that great relationship with them. It's very AB, if you will. It's very transactional. I think there are often times where you've got multiple regulators involved in the ECRO and ISCA process. It's not just one third party, it's multiple. And so they're jockeying for attention with the regulator, and you're somewhat of a pawn. And that makes it, to your point, Jessica, it does make it difficult. But as the compliance person or the person responsible for external audits, it's really important just to really build that best possible relationship, but still, as much as you can with your regulator directly, building that relationship. If things go wrong, make sure that have be accountable when you're prepping your folks for audits and dealing with all of these relationships. Try and put as much of that out of the way, right? That's not their problem as business owners. They're responsible for their portion of the questionnaire, the RFI, the request for information, the survey, whatever you were calling it. And it's important to prepare them. Hey, when you're asked questions, make sure you say thank you. Make sure you smile. Be honest. We're not asking anyone to tell any stories here. Orange does not look good on anyone. Sorry. Sorry, Elvan. I know that's one of Elvan's stories, but as
But
much as
that's true. That is so true.
you don't look good in orange, so don't lie. But if you don't know, be honest and say, I don't know. But then typically follow it up with, but let me find out. Let me ask someone. We need to get so and so in the room. Give me the signal as the person running the audit so that I can say, hey, can we have 5 minutes so that we can get the right person in the room? Let me advocate on your behalf, but let's have that conversation. So I think that's all really important. And if to your point, Jessica, if they're on the verge of tears, they feel exasperated, they're asking a question that you didn't prepare for, because sometimes auditors they'll wander and they will push. It's not a gotcha. They are truly curious sometimes about how we're doing things. Sometimes we are doing a good thing and they want to know more. So they will start to ask questions that's maybe outside of the scope or the boundaries of what we prepared. But it is so important that we prepare for those situations. If they need they ping me or they give me the signal, or they go like this or whatever it is, so that I know, hey, can we take 5 minutes? And you ask for that pause. So prepare for things to maybe go a different way than you hoped, and
And
just
it's
figure out what you're going to do.
and there's no doubt, see, Lorie's being really nice, but there is on occasion an auditor or an ECRO organization who is a pain in the petunias. There is no doubt about that. I don't want to say, I could say something else, but use your imaginations. But just stay calm, recognize what they're doing. It's not about you. And like Lorie said, if you need a minute, just say, can I come back to you? And just remember, stay calm. It's fine. It's them. It's not you. Hey,
Yeah.
we're running out of time, but there's a really important question as we were prepping. This one's from Elvan. We were talking about, and I just want to cover this before we close because I think it was such an amazing topic. Elvan, yesterday when we were prepping, you talked about the role of AI in these audits. Do you remember what you asked? I think you asked, is the government allowed to use AI?
Correct.
See,
I did ask that. And then I went and then Lorie said, Elvan, ChatGPT is not doing a good job answering things on the topic, but against all good advice, this morning I went and asked the same thing to ChatGPT, and I thought to myself, Lorie's going to be on the call. Don't worry. That's exactly the train of thought.
No, but we had a great discussion about this. Is the government allowed to use AI? I mean, things are changing so fast. And
Mhm.
Lorie, you had some really good insight about what's happening. I know that there's some legislation in some states
Mhm.
around the use of AI, but what are you seeing? What's some insight for our listeners before we sign off?
Yeah. So the big thing to note is that at the CMS level, they have announced intention to start using AI on the Medicare and Medicare Advantage side. I suspect that at some point it will
Mhm.
cross over into Medicaid, but as of right now, in October 2025, I don't know that they have crossed over fully into
Mhm.
Medicaid. So that's the first thing I want to say. The second thing that I wanna say is because it is Medicaid and there is state funding, state laws apply.
Mhm.
So you really need to know what's going on in your specific state as it relates. Many states, not all states, but many states have started to pass AI specific legislation and
Mhm.
govern its usage. In some states, they've passed like an ethics board, an AI committee at the state level, if you will, that
Mhm.
really dictates how it's used. In terms of these third parties that are coming in to do your audits, if they're using AI, is it possible? Absolutely, that they're
Mhm.
using it, particularly if you're submitting a year's worth of claims or encounters or case files or member calls or whatever, they may be using some AI. I don't know that for sure. So before any third party regulators come at me, I don't know what you're doing for
Mhm.
sure, but there I suspect, that's a lot of data to rifle through. So they may be using some tools. But again, a lot of it is dictated much like whether you can do business outside the US for Medicaid
Mhm.
dictated at the state level. So your first source of truth is always going to be your state agreement that you've signed with the state. Jessica called it the model agreement, which in most states you can Google and look at
Mhm.
it if you're not active in an MCO or a health plan, but really look at what your requirements are. And ChatGPT did help me come up with a summary, Elvan, that I can send you for what states are going on. I will say that in Pennsylvania, where Jessica and I reside, there is active legislation. In
Yeah.
Michigan, where Elvan resides, they are thinking about it, but there is nothing that has been officially signed by the governor of Michigan. But to Jessica's point, it is a hot topic that is
Mhm.
moving rapidly through legislatures, and I anticipate that all 50 states in the next couple of years will have formal legislation on the books.
Mhm. And again, much like most everything with AI, right? We're going to have to deal with the consequences, just like you said, of those decisions. There are great benefits to be able to automate certain things, standardize. It takes away that
Yes.
little segment that we talked about, the personalities and
Yes.
the variability and all of that.
Yeah.
However, once that's in place and both parties agree to how much and how AI is going to be used, then we still have to walk through the same concepts that we do today. Is there a data bias by the AI? Is there any problems with the algorithmic decision making
Mhm.
process? Who's
Mhm.
going to check the governance of that, the security of the models, security of the data that's going to be imported in there, you know
How easy
validation
will
of
it be
outputs.
to appeal a certain outcome or finding if you don't know the
Yes.
algorithm and you don't know what's happening?
Correct. There's that black
Yes.
box, right? We always talk about those models are very still to this day. We go through the same process in my company. Certain things are trademarked. They're not going to share with you. But what does not
That's right.
sharing mean for the
Yeah.
parties that are affected by it? So we're going to have to walk through all of that when it shakes out.
Yes, and it's important that when you're submitting information, Alvan, that, you're appropriately bookmarking or redacting information
Mhm.
that you can't disclose. But remember that these auditors, they're third-party auditors that are coming in for an ECRO and ISCA, they've all signed, at minimum,
NDAs or
probably an NDA or a BA, a business associate
Mhm.
agreement, a non-disclosure agreement, something like that. So whatever you would give to your state regulator, without exception, you can give to this third party auditor. I know, and Jessica, the lawyer, that's the first question that a lot of folks in legal will have as well. Can we actually share this with them? Think of them much like you think of your own third party vendors. They are an extension of your state regulator. So it's really important that you remember that, be as transparent as you can, but anything, typically rate related, because remember, one of the things that we haven't talked about as we're wrapping up is that the results of this audit get published on the state's website every year. There's a technical report that's published that the summary of the ECRO and the ISCA are published publicly. Your MCO or your health plan name may not be made public in that report. It may talk about generalities, but sometimes they do name your MCO. So it's really important that if you wouldn't make it public, you probably want to redact it, and the state will typically work with you on that.
There is so much. I think we're going to have to do a second episode and think about that maybe, in the new year. But we could do a deeper dive. There's so much more to talk about, and maybe hints and tips about how you actually experience or respond. And there's a lot more we could talk about. Is there anything, Elvan, Lorie, anything else big that we want to touch on today?
I think those are the big ones. I would, encourage anyone in the Medicaid or CHIP space that may be going through their first external quality review, internal systems capability assessment, read the protocols. AI can help you summarize the 411 pages. If you're not a nerd and you don't want that, there are great tools out there to help you. I will say a lot of times the questionnaires or those requests for informations that come with the ECRO and the ISCA, they are very informative. There's a lot of insights in there. Start to keep a repository. Look at what you said last year. Has a lot changed? Make sure you plan to submit a lot of policies, a lot of evidence to really back up what you're saying. Demonstrate that what they're asking for is in practice.
And I'd add that if you don't have the internal resources, it is, Lorie, I love this phrase. So Super Bowl audit. So it's easy to maybe underestimate how much effort really has to go into these particular reviews. Make sure you're resourced. And if you don't have the internal resource for it, get help. Get somebody who knows what they're doing, who can help guide you as you progress. And there's no shame in doing that. The benefits, the return on investment, if I have to use that phrase, will pay dividends. So just a plug, shameless for Simply Compliance. I'm kidding. But that was a really fantastic episode, really insightful. For those of you who are listening in, we hope it was helpful. We hope you learned something. And even if you're not in the Medicaid space, hopefully you get a sense of what some of your other colleagues are going through and they experience, and you understand a bit more about the complexity of healthcare compliance in a slightly different piece of the healthcare space that you're in. So thank you very much for listening, and stay tuned for the next episode. We'll see you next time. Thanks, everyone.
Thank you. Thanks,
Bye,
everybody.
ladies.
Bye-bye.
Bye.